Probably the most common question the parents ask me is, how likely is it going to work? And very good studies all show very strikingly similar results. Doesn't matter the age, maybe a little bit sort of, the under age 8 doing better than over age 8. It's controversial. But overall, age doesn't matter, gender doesn't matter. As we're learning at this meeting and many others, country, region of the world doesn't seem to matter. Epilepsy syndrome does. Some do better than others. But if you look overall, it's strikingly similar. You're in the 45 to 55% chance of benefit. Thousands of patients over the years. It's kind of interesting that it's so strikingly similar. And that's what we tell the families. We say 50-50. And I'm an optimist. I say, I think it's going to work. I think 50% chance your child's seizures are going to be better. Then they say, how much better? I say, well, if you look deeper in that number, about 15% seizure-free. And they say, okay, that's kind of low. And I say, well, but if you look at drugs, most drugs after 3 or 4 drugs, it's about a 30% chance of benefit, about a 5% chance of seizure freedom. And that's what Helen Cross in her study showed, that the diet is certainly, when you're in that situation, better than medications, and why we really move in that direction. You're not, with anything out there that I've seen, going to get close to that 50% responder rate and 15% seizure freedom. And we're seeing that now for adults too, who are looking for new options. That the diet sure looks good compared to trying another drug when many have failed.